How to tell if a pancreatic serous cyst is dangerous. How can you tell if a pancreatic serous cyst is dangerous? This is a question that many people may have, especially if they have been diagnosed with a pancreatic cyst. Pancreatic serous cystadenomas are generally benign tumors found in the pancreas. They have a very low risk of becoming cancerous. However, there are certain factors that can help determine if a serous cystadenoma might pose a risk. First, let's talk about symptoms. Most serous cystadenomas do not cause any symptoms and are often found by accident during imaging tests for other health issues. However, if you experience symptoms like abdominal pain, jaundice, weight loss, or a noticeable mass in your abdomen, these could indicate that the cyst is large or causing complications. In such cases, further evaluation is necessary. Next, imaging studies play a crucial role in assessing these cysts. Computed tomography scans and magnetic resonance imaging are commonly used to identify serous cystadenomas. These cysts typically have a distinct appearance, often described as microcystic or oligocystic. If the imaging shows atypical features, such as a very large size or solid components, this could raise concerns. Monitoring the size of the cyst is also important since serous cystadenomas usually grow slowly, at an average rate of about 0.29 centimeters per year. Significant or rapid growth may warrant closer examination. Malignant transformation of serous cystadenomas into cancer is extremely rare, occurring in less than 3% of cases. However, there have been documented instances where a benign cyst became malignant after many years. This highlights the importance of long-term monitoring for some patients. If imaging results are unclear or if there is suspicion of cancer, doctors may recommend further diagnostic procedures. Endoscopic ultrasound and fine needle aspiration biopsy can provide more detailed imaging and tissue samples to help differentiate between benign and malignant cysts. In terms of management, most serous cystadenomas do not require surgery or intensive follow-up due to their benign nature. Regular monitoring through imaging is advised if the cyst is large, symptomatic, or shows changes over time. Surgery may be considered if the cyst causes symptoms, grows significantly, or if there is uncertainty about malignancy. In summary, a pancreatic serous cystadenoma is generally not dangerous unless it causes symptoms, shows unusual imaging features, grows rapidly, or undergoes malignant transformation, which is rare. Diagnosis relies heavily on imaging and sometimes biopsy, while management focuses on balancing the low risk of cancer against potential complications. Always consult healthcare professionals for personalized evaluation and care.